The National Care Association says UK officials had put lives at risk by issuing incorrect reassurance about personal protective equipment. The organisation discovered that official guidance, which said out-of-date masks were safe to use, was incorrect. This was revealed after the government issued a recall notice to care homes and local doctors' practices in June. At the peak of the pandemic, many care homes reported that personal protective equipment was being diverted to NHS hospitals. And as a result, they experienced shortages of masks, gloves and goggles. Well, the British Medical Association said it's a dereliction of duty not to ensure the safety of patients and staff.
These reports, if true, are nothing short of a national scandal. If doctors and healthcare workers have been supplied with and worn faulty, redated masks, this is clearly a dereliction of duty to ensure the safety of NHS staff and patients. Suggestions that these faults were known about in May, and yet action is only now being taken, are alarming.
Well, meanwhile, the government claims the issue is now resolved.
The safety of frontline staff has been a priority throughout this unprecedented pandemic. After being made aware of a defect with some Cardinal Health IIR surgical masks, we urgently issued advice last week to health and care providers to check if their stock included these masks and to dispose of them. The issue is now resolved.
Well, that comes as the Department of Health and Social Care has announced that care home staff will be tested weekly, while residents with dementia or aged over 65 will be tested every 28 days. A new social care testing strategy is set to begin on Monday and aims to stop the transmission of the virus.
How reliable is it?
Well, for more on all this, I'm now joined by the expert in communicable diseases, that's Dr. Bharat Pankhania. Dr. Pankhania, thank you for talking to us. Is this another example where the government appear to have neglected care homes?
Very much so, and I'm so disappointed even listening to that answer when the minister said this matter is now resolved. Well, the matter is not resolved because initially out-of-date masks were issued and then the statement was made that actually we have quick tested them, rapid tested them, and that these masks are okay.
Well, the doctor...
Having said that,
sorry, carry on,
in June... Having said that, in June, they now say we need to withdraw these masks. So there's a lot of loss of faith. And you need to answer this rather than to say the matter has now been resolved.
Well, doctors being issues with out-of-date masks, that's also been a problem for the local doctors, the local GPs as well, hasn't it?
Indeed. And so we heard the report from the British Medical Association saying, this is unacceptable. And I agree. The unacceptability is as follows. You don't reassure on the one hand, and then months later you withdraw it, and then subsequently say the matter is resolved. We need transparency. We need honesty. We need candor. It would be much better to say we made a mistake.
Well, the government did finally issue a recall notice. I mean, what more can they do? I mean, it has been an unprecedented crisis, so mistakes were perhaps inevitable, weren't they?
Well, mistakes are not inevitable. People need to be careful. This is a large organisation. Many lives are at risk. But when you do make a mistake, it is expected that you say, we made a mistake, rather than to say the matter has now been resolved. Because what happens if you don't answer those questions is you end up with loss of faith, loss of belief in the system, and then people get anxious, and then there will be low compliance with further directives that come along the road many months from today.
Well, at the beginning, the hospitals were the priority, weren't they? But the government knew that care homes were under threat weeks before, didn't they, when they saw what happened in other countries like Italy?
I think what has happened in the care homes requires a much independent inquiry, because the tragedy of in excess of 20,000 deaths as a result of introducing infection into the homes by discharging patients from the hospital to the homes to make space in the hospitals for expected pandemic coronavirus cases is a big failing upon our part. And we've let the care homes down. These are our elderly, very vulnerable relatives, and we mustn't do this.
Is it entirely right, Dr. Pankhania, to blame the government for the failures in care homes? I mean, most of the care homes are actually in the private sector, aren't they?
They are in the private sector, but we have a duty of care to make sure that they are operating properly. And in the middle of a crisis, you do not put pressure upon them to say, you have to accept these patients because we now have an emergency. You accept them if they are safe to be accepted. And I have always advocated that our care sector needs a good revamp, and you need to almost consider taking them over, because most of them are not, financially viable as it is. It would be much better to say we're going to take it all over under the umbrella of better care under the National Health Service.
Dr Bankania, because of what's happened with the care homes as well, do you think it will dent public confidence in the government's response?
It has dented it, and we really need to, here on going forward, is to say we're going to have candour, we're going to have honesty, transparency, and we're going to say we made a mistake and make up for it when you do. Because it's pointless not answering the question. It just leads to frustration when, even in PMQs and on interviews, when ministers are not answering questions, it leads to a lot of frustration.
Aside from candour as well, finally, Dr Bankania, what would you like to see the government do from now on?
I really would like consideration for the science. The science is telling us that the virus is still out in circulation. Then there is the science of communication. So we need to communicate this succinctly, sincerely, consistently. The virus is out there. Please be careful. We have lifted the lockdown. I feel it has been premature, but at least please be careful and keep on reinforcing that message.
Dr Bankania, many thanks for your thoughts. Thank you.
Thank you.